India's government denies it has a problem with its uranium mines, but kids who live nearby are often born with congenital deformities. Their limbs are stunted, and there's a high rate of tumours. In fact, Indigenous villagers who live near the mines have higher rates of leukemia, cancer, sterility, infant mortality, and early death. But the government says it's safe. It blames their health problems on what it calls unsanitary living conditions. For almost 2 decades, government health officials have said that yellow cake poses no threat at all.
Please do not give credit or discredit for everything to nuclear radiation. In any case, yellow cake does not give any harm unless it goes inside your body, because yellow cake is uranium, which is pure alpha emitter. You can handle uranium by bare hands and nothing will happen to you.
Which is lucky, because it's handled by workers without protective clothing. It's roaring through their communities on uncovered trucks. Its radioactive byproduct is dumped into pits where kids play, and it's leaking into the water supply. Yep, for the last 2 decades, these communities must be feeling very lucky.
A nuclear nightmare. Children with mutations on almost every street. Deformed heads, lopsided bodies, toad skin, eyelids turned inside out. School built using radioactive waste. Part of community outreach project. Nuclear expert? Exceptionally worrying. No one should be living anywhere near this. Now you would have thought this was Fukushima. This is India. These poor people that are handling the uranium mines, they're not wearing any protection whatsoever. Nothing to protect their hands. They're probably breathing in this yellow cake as well. And the officials are telling them, don't worry, you'll be okay. They won't hurt you. How India's nuclear industry created a river of death. Researchers found that the Subarnarekha River in areas around Jadugoda, India, were poisoned from the emissions of a nearby secret nuclear factory. The Center for the Public Integrity has revealed hundreds of pages of personal testimony and clinical reports in the case that presents a disturbing scenario. Doctors and health workers, as well as international radiation experts, say the nuclear chiefs have repeatedly suppressed or rebuffed their warnings. Epidemiological and medical surveys warning of a high incidence of infertility, birth defects, and congenital illness. Deepak Ghosh, a respected Indian physicist, Jadugoda University, with his team collected samples from the river and from adjacent wells, and he was alarmed by the results. It was potentially catastrophic. Millions of people are along the waterway where this area of exposure. Many said their children were born with partially formed skulls, blood disorders, missing eyes or toes, fused fingers or brittle limbs. Analyzing a representative sample of people between 4 and 60 years old within 1.5 miles of the third Tailings dam, the researchers hired by the Uranium Corporation of India Limited concluded that the residents were affected by radiation. Symptoms include swollen joints, spleens and livers, and coughing up blood. The UCIL report also described of osteoporosis, defective limbs, and habitual abortion, as well as many complaints of missed menstrual cycle and a cluster of cancer cases. The American diplomat warned that lax safety measures are exposing local tribal communities to radiation contamination in a confidential cable to Washington. Another study had concluded in living close to the mines reportedly suffer high rates of cancer, physical deformities, blindness, brain damage, and other ailments. UCLI refuses to acknowledge these issues, post-context citing independent research saying that it's difficult to point out any reason other than radiation. Surendra Gadekar, a nuclear physicist, began taking soil, water, and air samples. Their study was published in 2004. It found radiation levels inside the villages around the tailing ponds were almost 60 times the U.S. Nuclear Regulatory Commission's safe level. They also documented the existence of neighboring populations of children with malformed torsos and deformed heads and wrong number of fingers. as well as a cluster of cases where infants' bodies grew at different rates, given they made lopsided. Some had hyperketosis, a known condition as toad skin. In late 2000, Hiroki Coyote, a nuclear engineer who teaches at Research Reactor Institute at the Kyoto University, took soil and water samples. These figures were exceptionally worrying. Coyote said, "No one should have been living anywhere near." Coyote informed the uranium rock and finally ground mine tailings had been used as a ballast for road leveling and as a house building and to construct a local school and clinic. Confirmed these construction projects using irradiated materials had gone ahead as part of a community outreach project. India's nuclear nightmare, the village of birth defects. Neither Alawadi nor Dunya can walk, nor can they hold anything. Their limbs dangle lifelessly. Their knees and elbows are rubbed raw from crawling. They need help to bathe and use the toilet. Children with deformities like Alawadi and Dunide live on almost every street in Jadugoda. When people began to notice that young women were having miscarriages, witches and spirits were blamed. But people had lesions. Children were born with deformities. Hair loss was common. Cows couldn't give birth. Hens laid fewer eggs. Fish had skin diseases. Local media reported, including shocking pictures of children who were sick and deformed. Another report showed Indian Doctors for Peace and Development, a non-profit, found a far greater incidence of congenital deformity, sterility, and cancer. Like Alawade and Dunye, he drags himself forward with his elbows. A few huts away, a child's eyelids are turned inside out. In Japan, now they just signed a nuclear agreement in India for nuclear reactors to go in there. Toshiba, Westinghouse, they're going to build 6 new reactors in India. Now, another problem with India is they have a huge population and they have a limited water supply. A lot of that water from Tibet, I know China's trying to get that water from Tibet, that was going to India, but now when you cut off the water supply and you add all these reactors, it's a bad circumstance where you could have these reactors run low on water. That's just a really bad scenario. 8,000 years ago, supposedly, they found decaying nuclear materials that only could have been possible by man-made fission. Could have been a nuclear explosion by Rajasthan thousands of years ago.